is also for the obliques, and it's just an isometric for the abdominal muscles to help tone them and get some of their strength back. This one can be done in any functional position. You can do it standing. I'm sitting down, and I prefer sometimes to do it on a chair with my back supported so I can just relax and do the contraction. So this isn't the ideal sitting position, but I'm going to show you a couple variations. What you're going to do is you're going to sit and you're going to let your stomach relax, and you're going to be in a nice upright position. And you're going to gently pull your belly button in a couple inches, and then hold that for count of 10 while you try to breathe normally, or at least keep some air moving. I'm talking the whole time so I know air is moving. And then you're going to relax. Okay? You do a lot of those throughout the day in different positions. Another thing that you can do is, well, one thing you want to watch for is your hand on your chest. I have my hand on my chest to make sure that I'm not pulling in like this, because I'm cheating. I'm not really using my abdominal muscles. I'm just lifting up my chest to flatten the stomach, and that's not what we want to do. We want to keep this chest down and relaxed and pull the belly button back so that you're feeling your abdominals do that. Now you're only going to use about 30% of a maximum contraction. We don't want to do any strong bracing. That's not what this exercise is about. We want gentle stability that we can use throughout the day when we're doing other things. This isn't like your big deadlift or anything like that. So that's one of the variations that I'll have you do. And there's also the option to do it in side lying, so I'll show you that one really quick. You can have a pillow under your head. I'm just going to put my arm here. And this is great. You can also do this position while you're nursing. If you have a little one that you're nursing, you can do it while you're watching TV once you get used to the motion. But what you're going to do is let your stomach relax, and you'll be able to feel yourself pulling against gravity. So this is a good one to get a feel for it. You're going to be on your side, pelvis level. Pull that belly button gently in. I'm using an exhale breath to kind of help with that. I'm holding it there for a count of 10 while I breathe normally or talk normally, and then I'm going to relax. Okay, so I do about maybe 10 of those, and I fit them in a lot throughout the day too. All right, I do 10 of them in the morning, 10 of them in the evening, to make sure I'm getting at least 20 in. All right, that's it. Okay, right now Kendra's going to show us our postural exercise. This is a quick and easy way to set yourself up with a good back posture. You're going to just find a handy dandy little wall, back up to the wall. Your heels can be away from the wall so that there's room for your butt to fit on the wall. And then you're going to have your buttocks against the wall and your upper back. Try not to pull your shoulders back, just let them relax at your sides. And if you have a huge arch at your back, just let your ribs come down and connect, and bring your belly button in just a little bit. Notice how she still has a little bit of an arch there. That's normal. If the upper back and the butt are touching the wall, you've really taken care of any excess sway at the pelvis, and with your tummy in, that's going to kind of bring you more to a midline position. And then you can step away from the wall, and then just have that be, just know that that's your kind of home base posture. It's not where you're supposed to live all the time, but it's a great home base to come to. Okay, now Kendra is going to show us our postural exercise. This is a good upper body stretch. It's great to do post-nursing or any time that you've been leaning over and sitting a lot. You can also do it pre-nursing to get yourself comfortable. I'm going to have you find a nice flat wall, and you're going to back up to the wall, but you're going to have your feet away from the wall, and you're going to let your back, your upper back and your butt rest on the wall. Bend your knees a little bit so you can kind of flatten your back against the wall, tummy in, and then bring the backs of your upper arms against the wall. You can start with your elbows down a little bit, and then start to slide those hands up. Now you might feel this one in your pec muscles and your chest muscles, and then just hold for a little bit and come back down. You can come all the way back down and just work up into the restriction. You may go farther than her, you may not go quite as far as Kendra is here, but that's your basic motion. Stretch for a little bit and come back down. You know, you can do about 5 to 10 of these. You can do them anytime you want to kind of loosen up your upper back and get into a position that you're maybe not used to doing all the time. And that's the back to the wall arm slide. Okay, Lindsay's here. She's going to model our next set of exercises. She is pre and postnatal. She has a 15-month-old daughter, and she's about 20 months along on her second pregnancy. She is going to show us how to set the TheraBand up in the doorway. You'll take your 2 pieces of TheraBand with the knotted ends, and you're going to loop those knotted ends over the doorknob on the opposite side. And then after you have it looped over, you're going to drop it down so that it doesn't get caught in the tab, and then close the door, and then just give them a little tug. Make sure they're stuck in there really well. Make sure your TheraBand is good and firm and new and doesn't have any tears in it. And then she's going to grab it by the handles, and she's going to show us how to do a pull-off press. So she's going to turn around with the band out to her side, and she's going to feel a little bit of pull on that band. It's trying to pull her the opposite way, but she won't let it rotate her. So she's keeping her hands at midline, and she's going to get into a little bit of a soft knees position. She's going to push that band away from her and pull it back. And that whole time she's using her abs and her glutes, kind of naturally happens, to keep that band from pulling her to the side. You'll do however many repetitions that you have in your plan to do today. And then our next variation, she's going to stir the pot. So she's going to make a big circle with that band, and notice that she's keeping her trunk absolutely still. She's going to circle one way. I'm having her do about 5. One more, and then she's going to circle the other way. And notice how she's keeping everything nice and still. A lot of people like to really turn that trunk, but I don't want you to. So you may have to vary how big you make those stirs until you feel like you're strong enough to control it. You get to decide. Now, you're never done with it if you've just done it with the band going off to your right. You need to turn around and do the exact same thing facing the other way. And you'll notice when you feel it that it works that glute on that side. So she's going to go forward and back 5 times. You might find one side harder than the other. That's normal. And then she's going to do circles each way too, keeping that trunk absolutely still. That teen core stays right in the center there. And then she's going to go the other way after she finishes her 5. There you go.